Welcome to the Risk Management course. This module will examine strategies to protect athletes when participating in Special Olympics activities. These procedures reflect the same precautions required to protect any group of vulnerable individuals, irrespective of any disability. To achieve the mission of Special Olympics, those responsible for supervising Special Olympics athletes in both training and competition must take positive steps to protect athletes as well as other participants. Screening of staff and volunteers is but one part of our responsibility to protect Special Olympics athletes. Screening is never 100% reliable. Therefore, we need to institute additional measures designed to protect athletes while they're in our care. The following is a summary of the Code of Conduct for all coaches and volunteers. Please read your provincial or territorial chapter Code of Conduct upon completing this training. 1. Volunteers and coaches must show respect for others. This includes showing respect for the rights, dignity, and worth of all athletes, coaches, volunteers, and event spectators. 2. Ensure athlete health and safety by making sure that equipment and facilities are safe and that the training and rules are appropriate to both the athlete's age and ability. 3. Volunteers and coaches must act professionally and take responsibility for their actions. As an example, at no time should a coach or volunteer be under the influence of alcohol or other controlled substances during any Special Olympics events. 4. Ensure a positive experience by respecting the talent, developmental level, and goals of each athlete. In addition, ensure that each athlete competes in events that challenge their potential and that are appropriate for their skill level. 5. Continually uphold and ensure the quality of services to athletes. To do so, seek improvement through performance evaluations and available training programs. Ensure that you are familiar with the medical, training, and competition history of any athlete for whom you are responsible. Athletes are also expected to adhere to a code of conduct. The Athlete Code of Conduct states that athletes must 1. Abide by the rules of competition, specifically the Special Olympics official sports rules. 2. Know their rights and responsibilities as an athlete. 3. Abstain from all illegal activity. 4. Avoid disruptive behavior. This includes behavior that is dangerous to self and/or others, including acts of violence, harassment, physical or sexual abuse. 5. Avoid language that is profane or abusive. 6. Maintain high standards of conduct, including self-control and responsible behavior. An athlete should consider the well-being of others and display courtesy and good manners. And 7. Honor the Special Olympics oath. Let me win, but if I cannot win, let me be brave in the attempt. For the complete Athlete Code of Conduct, please check with your local chapter. In order to prevent physical abuse, all volunteers and coaches must adhere to the following. Refrain from the use of corporal punishment in all instances, including hitting, slapping, spanking, or other forms of physical discipline. Never withhold food or water as a form of punishment. It is very important that water is always available to athletes during practice sessions. Always refrain from helping athletes with personal care and hygiene, as this should be performed by personal support workers. And do not dispense medications which have not been prescribed by the athlete's physician as indicated on his or her consent form. To prevent emotional abuse, all coaches, Special Olympics staff, and volunteers will treat athletes with courtesy and respect. Under no circumstances should a coach or volunteer use profanity or otherwise curse at athletes, officials, or spectators. At no time will Special Olympics athletes be threatened or intimidated for any purpose, including improving athletic performance or improving behavior. Any discipline techniques that are employed must be constructive and positive. Physical contact is important for normal human development. Hugs can be especially important to reinforce the positive nature of athletic competition. Hugs between Special Olympics athletes and coaches or volunteers should be open and respect the limits set by the athlete. All staff, coaches, and volunteers must respect any resistance by the athlete to physical contact. Remember that hugging is an activity involving more than one person, and respect for boundaries must be mutual for all parties. There may be times that an athlete will attempt inappropriate physical contact with a volunteer, staff member, or other athlete. In such cases, the coach, volunteer, or staff member should identify the inappropriate behavior, explaining that it makes the volunteer feel uncomfortable, and that a better way would be to shake hands, do a high five, or use some other more socially acceptable form of expression. Setting boundaries is very important. Staff and volunteers need to be very specific about both the behavior that is troublesome as well as alternate ways to express the emotions that the athlete feels. In a case in which it is necessary for a coach or volunteer to speak privately to an athlete, this should be done within sight of others. When personal care support is required, families are encouraged to provide one-on-one support as needed. Volunteers are not required to provide support outside of their level of comfort. To protect athletes and volunteers, there should be at minimum 2 adult coaches or volunteers present when supervising activities such as showering, changing into team uniforms, and toileting. Any one-on-one interactions between a coach and an athlete should always take place in view of others. All incidents or questionable behavior should be communicated to your local Special Olympics chapter. To protect athletes, all coaches, staff members, and volunteers should at all times avoid touching any area normally covered by a swimsuit. In the case that a Special Olympics event requires the athlete to stay overnight, sleeping arrangements must take into consideration the age, gender, and developmental level of the athlete. Male and female athletes require separate accommodations, as do coaches and athletes. Coaches and volunteers will receive training pertaining to traveling prior to such events. Special Olympics staff, with the assistance of coaches and volunteers, should know where athletes are at all times while the athletes are in the care and custody of Special Olympics. It is important that coaches and volunteers be aware of the signs of abuse, both behavioral and physical, prior to working with athletes. Subtle changes in behavior may offer the only visible indication that an athlete is a victim of abuse. Abuse causes stress, and victims often exhibit the following stress-related behaviors: sleep disturbances, aggression, loss of interest and withdrawal from activities, depression, and immature acts. If changes in behavior are uncharacteristic and lasting for more than a few days, they may indicate a possible need for intervention. It should be noted, however, that such signs are not a certain indicator of abuse, as there are many other causes of stress. Signs of physical abuse may include, but are not limited to, questionable injuries that do not match the given explanation, repeated injuries or bruising to the same location. Bruises of different colors indicate different stages of healing, a potential indicator of injuries occurring over more than one occasion. Inappropriate clothing for the climate or weather conditions, unattended medical needs, chronic hunger and poor personal hygiene, statements by the athlete concerning inappropriate touching or physical harm. If you suspect that an athlete is being abused, please do not hesitate to act. Suspicious activity should be reported to a head coach and/or community leader or Special Olympics staff member. When writing a report or preparing to talk to someone about your suspicions, indicate the suspicious activity, when you witnessed the activity, and the duration or frequency. If you suspect that an athlete is in immediate danger, notify the police or appropriate authorities and then a Special Olympics staff member. Remember to always complete an accident report form. In some cases, you may be required to make an official report with the authorities. Keep in mind that reporting is not the same thing as accusing. It is just a way to alert authorities to investigate. Special Olympics reserves the right to utilize suspensions during the investigation and to expel athletes or volunteers as a result of suspected or confirmed physical, sexual, or emotional abuse of a Special Olympics athlete. Minor incidents such as paper cuts, small scrapes, or minor behavioral infractions should be recorded by a coach as a note. However, they may not require a formal accident report to be filed. All other moderate to major events, including but not limited to behavioral incidents, medical emergencies, property damage, theft, and code of conduct violations, should be recorded to your community leader or provincial or territorial chapter through a designated reporting method. Although each provincial and territorial chapter may differ slightly, the general guidelines for reporting an incident are as follows. Record or document an incident as soon as possible. Record any and all related verbal communication sequentially and as close to verbatim as possible. If it is a handwritten document, make sure it's legible and number your pages sequentially. Make sure your recordings include the time, date, and location of the incident. If the incident was witnessed, observed, or heard by others, please include their full given name and contact information. Be sensitive to the privacy of others. Your documentation should only be shared with necessary individuals. If you are unsure who should receive a copy of your documentation, contact a Special Olympics staff member. As a leader within the Special Olympics organization, you must take the steps necessary to protect yourself and your program. Preventing injuries to participants and spectators is a primary risk management objective. The following should be used as a guideline to assist you in developing programs and techniques which effectively reduce the risk of injury to athletes. Keep the appropriateness of the environment, including the venue and equipment. Provide proper planning for each step of training and competition. Medical assistance should be available when and where it may be needed. Appropriate levels of instruction and competition should be considered. And discuss any inherent risks associated with the sport or training with the athletes and their guardians. An Emergency Action Plan, or EAP, should be developed by coaches to prepare for a potential emergency situation. By preparing an EAP, coaches become equipped to respond to an emergency in a calm and responsible manner. An EAP should include procedures for emergency medical support, the event of a postponement or cancellation, communication, and incident reporting. Coaches will receive additional training about EAPs through the National Coaching Certification Program. Special Olympics Canada and its provincial and territorial chapters have the sole and absolute discretion as to any disciplinary actions to be taken if a person violates the Code of Conduct. Any action taken can be appealed as per the policies and procedures provided by your provincial or territorial chapter. The following is a list of disciplinary actions that may be taken. A warning may be issued. The individual may be placed on probation, and the individual may be suspended or expelled from further participation in Special Olympics programs or activities. The athletes and volunteers have the right to appeal disciplinary actions as per the PAN-CAN Special Olympics Canada policy. Please note that all appeals should be submitted in writing to the appropriate provincial or territorial chapter, and it is the responsibility of the appellant to make themselves aware of the timelines and procedures regarding the appeal process. This module will now cover other matters pertaining to risk management. All Special Olympics athletes, staff, coaches, and volunteers are covered by Special Olympics liability insurance. Proof of additional insurance coverage that you may be required to provide when you book a facility for Special Olympics use can be obtained by contacting your provincial or territorial chapter. Atlanto-Axial Instability is an orthopedic condition found in approximately 12 to 22% of individuals with Down syndrome. Misalignment of the first and second cervical vertebrae results in the potential for permanent damage to the spinal cord. All athletes with Down syndrome are required to be tested and provide results to Special Olympics in order to participate in safe activities. Individuals who have Down syndrome that have been tested positive for Atlanto-Axial Instability shall not be permitted to participate in sport training and competition which result in hypertension, radial flexion, or direct pressure on the neck or upper spine. Such sports and competition activities include, but are not limited to, alpine skiing, high jump, pentathlon, powerlifting, soccer, basketball, artistic gymnastics, diving and diving starts, butterfly stroke, and any warm-up activity which places undue stress on the head or neck. For more information on any of the items discussed in this module, consult your chapter's resources, the Special Olympics Canada webpage, or speak with a Special Olympics staff member. Additional risk management training is provided through the SOC or NCCP coaching course. Thank you. This module is now complete.